And if the membrane is ruptured, infection can ascend. Also, membranes often rupture because of infection. So for that reason, there is a standard treatment guideline in this country and in other countries that if there is prolonged premature rupture of membranes, the mother should be given antibiotics right away so that the baby can be protected from any infection. In this case, that was not done. The mother did not receive antibiotics. Second, there were important delays in the admission, diagnosis, and treatment of the baby after the baby was born. The baby was admitted to the neonatal unit only 3.5 hours after birth, at which point she was noted to be cold, blue, dusky, and in respiratory distress. She had polycythemia, which means that she was looking very dark in color, and she had infection because the blood test at the time showed white cell count that was very high and a neutrophil cell count that was very high, which are all indicators of infection. So there was a long delay in admission and treatment. Now don't forget the antibiotics should have been given a long time ago during the labor itself. So this was a very long delay. You were talking about half to a full day or more where the baby was not receiving antibiotics when in fact there was already infection. On top of that, the blood gas that should have been taken to see how the baby was doing was not taken until after 4 hours after birth. And then when it was taken, it showed very high carbon dioxide and respiratory acidosis, meaning that the baby was in respiratory failure all this time, and nothing had been done for 4 hours. The continuous positive airway pressure support for the baby was again started nearly 4 hours later after birth, despite the baby having respiratory distress. Now, she was eventually electively intubated, but 3 attempts were required before she was actually intubated and ventilated. And these delays subjected the baby to unnecessary acidosis, high CO2, and delay of antibiotic treatment. This was not a stable baby, as alleged by the prosecution witness. And in fact, this baby continued to deteriorate for the next few days until final collapse, with worsening symptoms of infection as we went along. Let's see what happened. So she was admitted, and as I said to you earlier on, she was already sick on that day. On the following day, she developed fever. She had intolerance when the CPAP was removed. In other words, she could not tolerate coming off the CPAP support. She had continuing deterioration of blood gases over the next day. She had increasing metabolic acidosis. All these indicates that the infection was in fact getting worse. The baby was not stable. And then on the next day, on day 3, she further deteriorated with rising CRP. Now, CRP is the test we do to see whether there's infection. And if the CRP is going up, it means the infection is getting worse. If the CRP is going down, it means it's getting better. And this was going up. There were repeated episodes of apnea and desaturation, again indicating the baby was clinically getting worse, not better. She then developed prolonged coagulation times. Coagulation times means how long does it take for your blood to clot? And normally, for all of us, it should clot within a certain period of time. If it takes longer than that, it means that there's a coagulation defect. Something is wrong with your blood. And in this case, the coagulation time was increased. Now, this is a serious development because it indicates that the infection is going out of control. Most of us, when we are infected, we are sick, whatever, the coagulation times don't change. But if the coagulation times change, it means that this baby is going into what is called disseminated intravascular coagulation. And this is a condition that appears when the baby is severely infected and severely ill because it causes spontaneous coagulation of the blood throughout the whole circulatory system. The blood just starts to clot everywhere. And as it clots, it consumes the coagulation factors, and that's why you see a coagulation defect. And then that leads to spontaneous bleeding in all the organs and elsewhere in the body. So when you see something that's starting to cause coagulation defects, this is in fact an early sign of DIC that is developing. And so the blood vessels in the skin are compromised because if you have clotting in the blood vessels of the skin, they compromise the blood flow, which together with hypoxia triggered dilation and contraction of the small vessels in the skin, which then results in the skin discoloration that you see, and tracking lesions and so on. And she ultimately collapsed and deceased. So this baby died of systemic sepsis, pneumonia, and disseminated intravascular coagulation. The mother should have received intrapartum antibiotics prior to delivery. There was delay in recognizing respiratory distress after birth. There was delay in starting antibiotics and delay in starting treatment for the respiratory distress. We did not find any evidence of air embolism.